Hi, I am Becca Stendahl, Program Director at MSEF, and I'm really excited to have Glennon Berezin with me today. She works at the the Mass Department of Public Health, and wants to share. I invited her to share some information about a platform around environmental and public health issues that I think is phenomenal and a great source of information for students and classrooms who want to look at some big issues that are locally, regionally, and globally relevant. So I thought this could be a great time to kick off some thinking about project ideas or sources of background research. So I'm going to pass it to Glennon and she can share the resources.
Thank you, Rebecca. I'm really happy to be here and happy to be sharing the Environmental Public Health Tracking website. I'm going to go ahead and share my screen so everyone can see the tool itself. So like Rebecca said, I work within the Department of Public Health and within the Bureau of Environmental Health. And for many, many years, we have been cooperative partners with the CDC, overseeing this program in Massachusetts called Environmental Public Health Tracking. And it's effectively our mission to make environmental health information and data available to the public. So we have a lot of content and background in a number of different areas, but we also provide the data itself. And one thing we're really looking to do is to make the data accessible and explained in a way that many different audiences could use, whether it's for a classroom or for a project or you name it, and essentially public health decision making too at its heart. So this is our homepage. You can recognize it by its lovely little array of leaves. We arrange things kind of, our health topics are in this health menu bar. Our environmental topics are here, and that's where you can find data and information in these areas. So if you were interested in a health topic related to the environment, so it's an environmentally related health outcome is kind of the terminology, you would go ahead and open that page up. You'd get some nice background information, and some related links along the top. And you would select this Explore Maps and Tables buttons to get into a query and actually access that data. So I'm going to hold off on doing that query right now. I just wanted to also point you to a couple of other resources. So how to use tracking is really helpful. There's a lot to explore on this website. And this can kind of guide your use of the website and the tools that we have available. It's how to use tracking, but from anywhere on the website, you can actually access it by clicking this tutorials link up at the top. And I would also draw your attention to this troubleshooting tips. So sometimes, we are a work in progress. Things are operating on the back end to keep the data secure and to pull that information in a real-time manner. So always just reference this page if you're running into any issues. Again, we cover lots of different topics, and one of great import is climate change, essentially. So we have a lot of great background information here. You'll notice the buttons here don't say Explore Maps and Tables, but there's actually this wonderful vulnerability mapping tool you can access here. And we also have our community profile highlighted on this page because it's enhanced with climate change information. Many of our pages also have these interactive data widgets. So here you're seeing climate change projections. So this gives you a quick snapshot of some data that's locally relevant. You can actually select a community and see the data for that particular community and look at things kind of that way. So I am actually going to click this climate enhanced community profile. It's not the only place that you can access this tool. You can get it from the climate change page. You can get it from our planning and tools menu page. This has a lot of really exciting tools on. I'll bounce back that to show you kind of a little library of resources there. And you can also see the community profile right from our homepage that I showed you here. There's a community profile leaf. So it doesn't really matter where you get it from, but this is a good place to start to orient your environmental public health tracking journey. And so this might take a minute to load, but you'll get this introductory page. You'll have a little bit of an FAQ about what this is, but essentially it's a snapshot of the data that we have available that we kind of cherry picked for the purpose of showing the data for a particular city or town. Sometimes it takes a minute to load because things are working on the back end. We're accessing data kind of dynamically and on the fly. And so patience is sometimes a virtue. You can see kind of this FAQ on the side again, and it highlights kind of where climate plays an important role. You'll see this shaded text box embedded throughout the report. And you can choose to view on screen or a PDF version for printing. PDF is nice because you can actually save it and then share it with somebody. But it's nice and clean to look at it as a continuous scroll on HTML. So I'm just going to go ahead and click view on screen. We've selected Worcester right in the center of the Commonwealth. And I promise you it will come up in just one moment.
It is neat to know that it's because the data is constantly like pulling and updating that it's not.
Yes, many of our reports are formatted that way, and you know, the graphics and the context and everything, it takes a while for everything to kind of populate. But it does ensure that as soon as we update the data in our production database, it is dynamically pulled into all of our reports. So you can be assured that everything is as updated as it can be. So you can actually click for a PDF directly from your HTML view as well. If you say, yep, I'm gonna save a copy of this. And you can also go directly back to a different community if you say, oh, I'm done with Worcester, I'm gonna move on to a different community. So again, it reminds you of your climate change flag. It starts with a little bit of geography and some basic information there, your total population. And it starts with some demographic information because, you know, historically, there are sort of the haves and have-nots when it comes to environmental health and environmental justice. And we want to make that centrally understood. And there are also groups that are potentially have a greater risk of impact for environmental insults. So because of who you are and you know where you live, essentially people of color and those of low income have historically been excluded from the conversation. You're more likely to be in your hazardous waste sites if you're a person of color or a person of lower income, or potentially can't speak the language, so you don't have the capacity to engage in those conversations. So that's kind of first and foremost what we want to include, but it also explains here, you know, older adults, people with disabilities, and children that have difficulty in extreme cold. There are folks that have specific vulnerabilities to climate, to environmental exposures, and so we want to try to make that as clear as possible, putting the people first. And so, like I mentioned, the community profile does spend some time discussing environmental justice, focusing on the definition of environmental justice based on the Executive Office of Energy and Environmental Affairs. It compares, whenever we have a statistic, we like to be able to compare that for that community to the state to see where it is based on kind of the average for Massachusetts. And then after kind of the demographic information moves into health. So we start with our childhood lead poisoning, lots of background information about what these outcomes are, why they are important, which I'm not going to kind of dive into each one here because we only have so much time. But again, flags for why it's relevant to climate change, what's likely to be exacerbated moving forward, comparing both male to female, kind of our sex, binary sex categories that's available in the data, and to the state. So asthma is included both from an emergency department kind of hospitalization utilization standpoint, but also prevalence in schools, which is a data set that DPH collects. And then from health, we move into environment. And again, this isn't everything that we have on tracking, it's just select indicators. And it's a good place to start because even this has a lot to kind of go through. And from here, you can actually make kind of select decisions about what you like to look at on the tracking portal or the tracking website. So air quality, water quality, no violations in Worcester to report of the 9 contaminants we track. And then a whole section specifically devoted to climate change as it relates to health and environmental health. And gets the conversation started about thinking about how climate and health are interrelated. What are we going to see more of? What's important to track moving forward? And for communities to think about planning and for climate change and thinking about, if this is unavoidable, how do we adapt? How do we protect our most vulnerable residents? And a lot of excellent resources here. I would encourage anyone visiting this to look through these links, and think also too about ways to reduce environmental exposures if you have the capacity to do so. Some metadata, some contact information, which is reiterated on our website, and a glossary of terms. So that's the community profile, and I would highly encourage anybody to take a look at that. Like I said,
I love the wealth of data, and just in terms of showing the systems and how all these pieces are connected, and reminding you why there's piece, because science doesn't happen in a vacuum, and having that connection where the research is such a great.
Yeah, absolutely. It's really hard to include the right amount of context, and not overwhelm somebody with that level of information. And so we try to walk the line between explaining, but not over explaining, and pulling out the pieces that matter. So hopefully other folks find that useful too. Our planning and tools section is as like a little library of dynamic tools similar to the community profile. So if visuals are really helpful to you and you're not sure exactly which parameters you want to select when you go digging into the specific data sets, these can be really helpful because they also provide that context with the data. So our childhood lead poisoning and prevention program are a partner of ours, and they have this childhood lead screening community progress report specifically tailored for clinicians and physicians. But it talks about why screening is important and why we should repeat screening if a capillary test comes back with a high value and things of that nature. And it's a city town level report. This talks about other partner or choose safe places for early education and care. There's no specific tool related to that, but it's also just a really important program when we're thinking about groups at risk. Where do you cite a child care facility when you're thinking about environmental contaminants in mind? There's our community profiles. And I just wanted to spend a minute talking about environmental justice in terms of our environmental justice tool. So we address it in the community profile. We have a webpage devoted to talking about environmental justice in Massachusetts. But we developed this tool to facilitate the use of policy. The Environmental Executive Office for Energy and Environmental Affairs, EEA's environmental justice policy. And so it presents data already calculated to reflect that policy. So we have both the demographic criteria, who in Massachusetts and where are these environmental justice neighborhoods, but also these vulnerable health environmental justice criteria that were added to the policy that look at specific things that would qualify an environmental justice neighborhood to be an environmental and vulnerable health environmental justice neighborhood. So basically, evidence of elevated higher levels of environmentally related health outcomes. And so it's a nice way of summarizing that data. You can look at a custom mapping tool as part of that, but it also just sort of presents the data in terms of trends for city and town and a view of the state. So I would definitely encourage folks interested in health equity to take a look at that environmental justice tool. And the webpage kind of goes into a little bit more detail about that. A flood zone mapping tool talks about health impact assessment. This is sort of where we envision our decision makers and our applied users of data would visit if they aren't necessarily ready to pull data and extract data themselves. So yeah, I guess I don't know, do you think it would be helpful to go into a specific data set and show what a query looks like and how to
Yeah, I think
export
let's
that
just
information?
show one query, because I feel like the what you've shared already provides so much information for folks to explore and see what sparks interest and where they can layer different pieces on. And so once you
Sure.
have that information, where do you go for more details? So you can kind of dive into that and then we can wrap up. That'd be great.
Okay, sure thing. So I'm going to go ahead and let's say you were intrigued by a data point you saw in the community profile regarding asthma. We know asthma is likely to be exacerbated by climate change. We know that we have higher levels of pediatric or childhood asthma in environmental justice communities. It's exacerbated by the air we breathe, by our indoor and outdoor environments. So you want to take a closer look at asthma. Again, we have kind of two asthma data sets. One is our hospitalization and ED visit data. The other is pediatric asthma. So it's a school level data set. I'm just going to go to the asthma hospitalization page. So you would see right away, if it loads for me, sorry about that. Again, it's pulling data kind of on the fly. This little, we call it our summary widget, where you can see particular communities' rate compared to the state and over time, and it's dynamic. So you could look at both emergency room visits or actual hospital admissions for asthma. And this is, you know, not age specific. Again, it's all of the community. Go ahead and look at Worcester. You see there's really high elevations there for ED visits, and some other towns might not be the same, but it's kind of fun to play with. And then this is where you would go for that information, explore maps and tables. And it's always up in the upper right-hand side.
What's cool about the widgets too is this idea of playing with them, because I think understanding how to read data is so important too. So this could be a fun activity to kind of see what changes and try to understand and interpret what's going on. So.
Absolutely. And I also think that, you can hover, and there's just a little bit more for data literacy purposes. Okay, what can the data tell us? And what do the data not show us? And I think emergency visit data is a really important one, because it's not prevalence. It's not like how many people have asthma. It's how many people are using the emergency room for uncontrolled asthma. And that's a really important distinction, because we're not capturing urgent care visits. We're not capturing visits to the pediatrician. This is folks that maybe have a little bit less access to care. They have to go to the emergency room, or their environments are uncontrolled. They're renting and their housing quality is not as good. So it's in some ways a really good indicator of places that need more attention from public health intervention. And then it also tells us kind of, oh, sometimes we see suppression because we have small numbers. So that's another place where I think you can kind of take a look at that widget and get a little bit of a taste for that. So here we have it's the actual query prompt for all of our hospitalization data. So you have more than just asthma here, but you select asthma to start. Let's say we want to look at ED visits, and you can select the type of geography you want to look at. Community is otherwise known as city and town. I'm just going to go ahead and select everything because it's fun to look at a big map of cities and towns, but you could look at a select set or just one. And then you can choose which year you want to look at. You can look at multiple years. I believe if you select multiple years, you may or may not get a map. It depends on the data set. But if you select multiple years, it could either produce a combined summary indicator called an average annual rate, or you might get just the map for that most recent year of data. So you can select separate by age groups, but I'll keep it all because we want to see the map. And then again, you can select male and female. So I'm going to go ahead and submit that. And you can also play with this query prompt, right? You don't necessarily need to do it once and then walk away, although it does take a little bit, it's a little bit more of an investment because there's many choices and you have to wait for it to load. So, but still, it can be overwhelming at first, but if you set yourself a couple of tasks, I want to see it by male, female. I want to see this for all these communities. I'd like to take a look at the county rate and see how Worcester compares to Worcester County. There's lots of different ways to think about it. And that's kind of true a step towards considering kind of an analytic plan. What are my questions and how am I going to answer them? So what loads, as you'll see, is a map of all of the communities that I selected. You can open up the legend, you can take away certain layers or put them back on. You can just focus on, let's say you want to just look at these really high values, the cities and towns that seem to be the most elevated for this particular year. And you can, another really cool thing here is that if you select a community, let's select Holyoke, it will let me. It highlights that community and you get a little info button over here to see that data right along the side. I'm gonna put this over. You can also, so all of this is covered in the tutorials too, but you can expand the view so you get a nice big map to look at. You're not kind of boxed in by screen real estate. Again, lots of notes about the data. What do those mean? How should I, when do I need to interpret with caution? You can look at them in a table view, a chart view, and you can export that information to Excel. So that way you actually have the data to play with if you're at that level of comfort with your data set, that you can manipulate the data yourself and maybe create your own visualizations. Yeah. And then some of this query parameters can be adjusted along the left side panel, but you can also revise your query or start from scratch.
Yeah. I think that being able to export into Excel or, being able to play around with the data, it just offers so much potential, right? In terms of what are publicly available data sets that you can manipulate. So you don't have to do the research and measure everyone in your community's asthma rates. Obviously, that's really difficult to do as a science and engineering fair project. But where can you pull some of that data to build a project off of?
Yeah. And it does also kind of open the world of where did data come from? What are those limitations? And you'll notice that some of these values are suppressed. You don't see them. So what can I do to understand more about that city or town? Do I jump up to a regional view of the data? Because a lot more space and a lot more people will boost the numbers up. Yeah. What is suppression to begin with? Which is, it's either, some sites suppress data because they're unstable. They're so small that one more case is going to change that trend line and we can't really trust that information. Or suppression in our case is about privacy. The data set that we access has rules about what can be showed publicly to protect the privacy of the person whose record is essentially being displayed here, de-identified, but still. So that's kind of a really interesting view of the data too. I don't know. Yeah. That's what I get excited about as an epidemiologist.
Well, I think this, go ahead.
No.
I think this is great. I think we should wrap up. Obviously, there's so much more to explore, but we'll include some links of different resources. I think that this big piece too is that, as you saw in the community profile, and I'm sure in lots of other places too, there are all those contacts and background information. Where did the information come from? So there's a lot to explore when you're looking for reputable sources for data and information.
Yeah, thank you. It's been a real pleasure. I'm going to leave you with this MassTrack newsletter page. It's kind of got a little bite snack meal of data and select tools that you can read about that are just 1 or 2 pages a piece. And you can subscribe to the newsletter. So you'll get probably 2 emails a year from the tracking team, whether it's about one of these released or new data set or something along those lines. Don't be shy about leaving feedback because we're always trying to improve. And, I think you'll share the contact information, but we do have that on the website too. And someone will be right there to answer your questions. So
great. Thank you so much. I really appreciate it. I'm excited to see folks exploring this and figuring out where to go with it next, because I think there's so much potential. So
awesome. Well, thank you for giving me the opportunity. It's been great.
Good.